name is Elise Ramos.
I'm Lauren Grimes.
I'm Kennedy Contreras.
I'm Marissa McGuire.
And today we're going to be talking about aging and dental health. So we are going to start with a little fun fact for you guys, a little did you know, okay? So did you know that 96% of patients in the category of 65 and over have had cavities in their lifetime? Another fact for you guys is that 2 in 3 adults over the age of 65 and older have gum disease. So not only do these patients have untreated tooth decay and they also have gum disease, 1 in 5 of 65 and older patients have lost all of their teeth. So it is very obvious that our patients 65 and older do have a contributing factor as to why they're having problems with their teeth, and it is their age.
So little objectives that we're gonna talk to you guys about today is common age-related disease and their effects, some medications and their effects. We're going to teach y'all about plaque decay, gingivitis, periodontitis. We're gonna show y'all how to properly brush and floss your teeth. You're gonna learn a little bit about interdental aids, fluoride, toothpaste, and different mouth rinses.
Little pre-test for you, and seeing as we're virtual today, we're going to go ahead and read it out loud, and we will be answering them through our presentation, and then we will go back over them towards the end. So our first question is, medications don't affect the health of my teeth, true or false? Number 2, what mineral helps strengthen your enamel and prevent cavities? Is it iron, is it fluoride, or is it zinc? And then our last question, how many times a day should you brush your teeth, and how long? Is it A, 2 times per day, 30 seconds each? B, 1 time per day at 2 minutes? And then C, we got 2 times per day for 2 minutes each. Next we're going to talk about today is xerostomia. Xerostomia is just a fancy word for dry mouth. It affects nearly 30% of the people aged 65 and older. The majority of it is from the medications that we're taking, but diabetes, Alzheimer's, and Parkinson's also have a side effect of dry mouth. Having dry mouth can give you gum inflammation. You can get, you're more prone to having cavities, cracked lips, and a fissured tongue. If you do have xerostomia, we do recommend that you sip water throughout the day. Try to avoid alcoholic beverages, caffeinated beverages, and any type of sugary drink. If you do drink it, drink just a little bit of it and maybe follow up with some water. Chewing gum helps as well, and then there are also some dry mouth products that we're going to talk about in just a little bit.
About the physical limitations that come with aging. So as we age, we do a lot of wear and tear on our bones and joints. So certain individuals can start to develop certain types of arthritis like osteoarthritis and rheumatoid arthritis. So people that have these certain different types of arthritis can struggle with doing every other day activities such as brushing your teeth. So in order to keep good oral hygiene, these people require modifications. So the modifications that we recommend would be people that are having wrist and finger pains. We would recommend having a thicker toothbrush handle, so it'll be easier for them to grip their toothbrush without experience all the pain. And then we also recommend an electric toothbrush. Not only does an electric toothbrush have a thicker handle, but it does all the motion for you. So people that are experiencing the arthritis in their shoulder and elbow area, they're going to get a lot of relief using the electric toothbrush because they're not having to use all the motion like you would in a manual toothbrush. And then we also have a floss holder. So people that are having the pain in their fingers, it's going to be really hard for them to grip that floss. So that floss holder is really going to aid them in properly flossing their teeth. And if you're not a big fan in using the floss holder, we do have certain interdental aids that you can use, such as a water pick, and we will go more into detail on what a water pick is and other interdental aids further along in our presentation.
We have loss of vision or blindness. If you're experiencing this, it may be hard to keep up with your oral health I recommend whenever you're brushing your teeth, only going over 2 to 3 teeth at a time. That way you make sure you go over each tooth. And then also I would recommend a electric toothbrush. That way it can benefit you by gliding it on each tooth individually, and the toothbrush head moves constantly in motion, so you don't really have to move your wrist and arm too much. And then also using a water pick can be suitable instead of floss. That way the water pick you can move it in small segments, that we get all the interdental areas to get out all the food and bacteria.
Next, we're going to be talking about cognitive limitations that can affect our oral health. So in the older patient, a lot of them do have Alzheimer's disease as well as some sort of dementias. So 5.8 million people in the United States do suffer from a form of dementia or Alzheimer's disease. Out of that 5.8 million people, 5.6 of those million people are aged 65 and under. Now, the remaining 200,000 will be patients that are 65 and under, and they have early signs of dementia and Alzheimer's. So some modifications to our dental hygiene treatment that may help with these cognitive limitations is to continue to educate oneself. So it is very important to keep the mind working at all times so that it doesn't lose its strength. When we continue to work our brains, it does help it gain stronger and not lose as much as brain cells as if we're not using our brain. Another modification that we can do is to educate our care and providers that do take care of us. So if our providers who take care of us are more educated in the matter, they can help with any cognitive limitations that we may be facing. Another modification that we can use is to use an electric toothbrush. So if we do forget to brush our teeth, maybe using an electric toothbrush would better get rid of all the plaque that's on those teeth from that buildup of not brushing it beforehand.
Medications and their role. First, a lot of common medications that cause xerostomia or dry mouth are non-steroidal anti-inflammatory drugs like ibuprofen or aspirin. We also have antidepressants like Prozac, antihistamines like Allegra, or anti-anxiety like Zoloft. All of those can cause dry mouth. We also have metformin, which is commonly used in older patients, and usually it's for type 2 diabetes, so you always want to make sure that you're looking after the xerostomia, and because that can cause a lot of cavities if you don't take care of that.
Alright, so chronic pain is another thing that's very common in patients that are 65 and over. It makes doing those day-to-day activities very difficult or harder than what it would have been when you were a little younger. Almost where that with that. So opioids are prescribed mainly for that. So so chronic pain, opioids are normally prescribed and help you through those day-to-day activities. Next we have our gastroesophageal reflux disorder, also known as GERD. This becomes more severe in elderly people, and antacids is the medication that we typically take for that, and that helps keep our acid down.
Talking about how these medications affect the oral cavity. So like we learned, metformin is a medication that is used to treat diabetes type 2 in patients. Now metformin does have some oral cavity effects, such as giving sore tongue, mouth ulcers, and causing vomiting. So if you are experiencing any of these side effects, vomiting can affect our teeth by eroding away the enamel on our teeth, which is the top and hardest layer of our teeth. So if this enamel is being eroded away from the vomiting effects of metformin, this can make our teeth more susceptible to cavities. And the next medication that we're talking about is opioids. So as Lauren mentioned, opioids are prescribed to older patients who are having chronic pain in their joints, and so this helps relieve this pain that makes these daily activities not as easier to do as they once were. So these drugs are very addictive, and if these drugs are taken multiple times a day or maybe very frequently by our patients, it can cause the destruction of our teeth because of all the harmful chemicals in them. So we want to make sure that we are aware of these, as well as dry mouth that can also come from opioid use.
I'm going to go over the antacids. So like Lauren said, antacids are prescribed to patients with gastroesophageal reflux disorder, which is called GERD. It's a little bit more severe case of heartburn, and it's also prescribed to patients with stomach ulcers. Taking these medications can result in dry mouth, and those patients that do have dry mouth are more high risk for cavities and gum disease.
We're going to talk about plaque. Plaque is going to be that germy film that grows on your teeth throughout the day, which is why we brush our day. The best way to disrupt the plaque is going to be to brush twice a day. Plaque can start growing on your teeth within an hour, and a poor diet helps it grow rapidly. So the better we eat, the more our plaque is going to remain lower. And it takes less than a couple hours to accumulate.
So now that we know about plaque, we're going to learn about decay. So what is decay? Decay can occur when plaque that is on our teeth is not removed adequately, and the bacteria and germs from that can cause the decay of our teeth. Now, how do I know if I have decay? Well, some symptoms of decay can be sensitivity to that area, because once you have decay, there is a hole that is now in your tooth, which exposes the inner workings of your tooth, making them sensitive to hot and cold foods. And another way to see if you do have cavities is going to be the discoloration of teeth. So if you guys can see on this picture here, there is a hole in this tooth with discoloration as well. So if you do open your mouth and see maybe a hole with discoloration on it, you may have a cavity. So how does aging affect tooth decay? Tooth decay affects your aging because 96% of people in the 65 and older category do have cavities. Now, if these cavities are not treated, the gum tissues tend to recede with age as well, and that also does not help with those cavities because our roots become exposed, which just leaves our teeth more susceptible to getting these cavities and tooth decay. And once we do have it, our teeth can become mobile because of this.
Okay, next we're going to be talking about gingivitis, which is a gum disease or infection. And according to Listerine, chronic gingivitis actually affects over 90% of the world. Common signs are redness, swelling, irritation, also bleeding whenever you floss, brush your teeth. And also gingivitis can also cause your gums to recede and order. So what causes gingivitis? If one does not remove the plaque daily in the morning by brushing and at night, plaque will build up into yucky calculus tartar, which causes irritation at the gum line. So at this first top picture, there's some plaque. It's yellowish in color. And then the bottom one, we have some calculus buildup, which will make a seal along the tooth and the gums, and that will cause a lot of irritation. And then eventually, if one does not remove the calculus, it can actually turn into periodontitis, and the patient can start losing some bone levels.
So now we're going to go into periodontitis. Like Marissa said, if gingivitis is left untreated, you can have more severity. So as you see to the left, here's your healthy gum and bone level. So if you have gingivitis and you're letting all that plaque build up and calculus, it starts to actually destroy the healthy tissues of your gums. So then it's creating a pocket. So as that pocket is getting bigger, that allows for more bacteria and calculus to set in. So after your healthy tissue is being destroyed, it starts going after your bones. So as you see, your bone is right here, circling around your roots. So if all that good bone is being destroyed, that's the only thing that is keeping your tooth in the socket, resulting into tooth loss. And that's something we really are trying to prevent.
Factors for oral health is not keeping up with your oral hygiene. So not flossing or brushing correctly, also not brushing twice a day. Some people only brush their teeth in the morning. Other risk factors are smoking, older age, xerostomia, medications. We also have poor nutrition, so a really not healthy diet, fast food, everyday sugar, sodas, and then also some other risk factors are hormonal changes, genetics, and medical conditions.
Some preventative measures that we can do to keep us from getting plaque, to keep us from having gingivitis, and to keep us from getting periodontal disease and bone loss. So we recommend you guys floss once a day. By flossing once a day, we can remove the plaque biofilm that is between those teeth, because if we don't, that can cause cavities in not one, but both of the teeth being affected. Another preventative measure is to brush your teeth, like we said, for 2 minutes a day, twice a day, in the morning and at night. Another preventative measure that we can do is to regularly go to our dentist's office and get cleanings that are recommended twice a year, every 6 months. By doing so, any plaque that is built up will be removed thoroughly, and you will no longer have to worry about a just massive pile of buildup, because we remove it every 6 months. Another preventative measure that we can do is to make healthy food choices. So whenever we make healthy food choices, such as those with less sugar, that will help to fight off the rapid growth of plaque, as well as managing our blood sugar.
We're going to talk about the types of toothbrushes. We have two major types of toothbrushes. We have our manual toothbrush and we have our electric toothbrush. Our manual toothbrush isn't timed, so when you're brushing your teeth and once you feel like you've reached all your surfaces, you're going to stop. It may not be that full 2 minutes, but that full 2 minutes is what we need to make sure that we are doing a thorough cleaning on all of our teeth. Our electric toothbrush is going to have a built-in timer, so you should spend about 30 seconds in each quadrant of your mouth, and that's about 2 minutes. Manual toothbrushes are not as effective as cleaning in between your teeth as, say, the electric toothbrush. Our electric toothbrush is going to have a rotating and sonic vibration, so it's able to get in between your teeth, the in-between surfaces better. Manual toothbrush is going to be better for orthodontics though, because it's going to be able, it's easier to maneuver on the top of the brackets and the bottom, whereas the electric toothbrush with its vibrations can actually loosen those brackets. Manual toothbrush again is going to be more affordable, and our electric toothbrush is going to be a little more expensive. We're going to show you how to brush properly. Today we're going to show you how to brush your teeth, and we're going to use the mass method. So in this first image here, we have our toothbrush tilted at a 45-degree angle. If you're not quite sure what a 45-degree angle is, if you make sure the bristles of your toothbrush are touching right at the base of the gum line and your tooth, you're going to, here I'm going to do this like right here. You're going to hold it and you're going to brush, sorry, we're going to go in the mouth this way, and we're going to brush around 2 to 3 teeth at a time, and then we're going to push away, and then we're going to move forward 2 to 3 teeth at a time, and then brush away. So while we're doing this, we're going to make sure that we get every tooth surface. So we're going to go all the way around the mouth and brush away 2 to 3 at a time, and then we're going to flip over to the inside surfaces of our mouth, which is our next one. And we're going to do the same thing. We're going to go in at an angle, and we're going to brush and wipe away, brush, wipe away, brush, and wipe away. Now, when we get to our anterior teeth, our front teeth, we're going to brush a little bit differently. We're going to move our toothbrush vertically. And what we're going to do is we're going to get in there and we're going to brush and pull down. So we're pulling down so that we're moving that plaque and bacteria that's built up away from our mouth, and we're not reintroducing it back into our teeth. And then we're going to do the same on the bottom. Again, vertical, and we're going to brush and pull, brush and pull. And then we want to make sure that we don't forget our chewing surfaces. So we did the outside surfaces, the inside surfaces, and now we're going to do our chewing surfaces. And it's very important because some of us have deeper anatomy in the top, the grooves of our teeth are deeper, and we get food stuck down in those. So we want to make sure that we're spending time on each surface. And then at the end, don't forget to brush your tongue. Your tongue is like a sponge, and so throughout the day when you're eating those foods, your tongue is just absorbing that food, that bacteria, the drinks, the sugar. So we need to make sure that we're brushing our tongue. When we are brushing it, we want to make sure we're pulling forward. Again, we don't want to reintroduce that bacteria back into our tongue, so we're going to brush, and pull forward, brush and pull forward. Make sure that you're rinsing your toothbrush really well afterwards because it can hold on to that bacteria. Okay, thank you, Marissa.
Alright.
And then we're gonna go over some modifications. So we should be using soft bristles. The hard bristles can cause damage to your oral tissue and it can cause recession in your tooth. So your gum line may recede up and expose more of your tooth, which can make them more sensitive. Use a modified handle for a toothbrush. So again, we were talking about earlier our physical impairments. Sometimes it's harder to grip those small things and maneuver them. You can get a dexterity grip, which is going to thicken that handle, or we can use an electric toothbrush as well, and it's going to make it easier to move that around. And then we have our electric toothbrush. Again, we have it self-timed, so we're making sure that we're brushing our teeth for 2 minutes. We're getting that ultrasonic vibration, so we're getting in between our teeth a little bit more than a manual toothbrush. And again, it gives you that thicker handle.
About brushing our teeth, we're going to be talking about flossing now. So why should you floss? I already brushed all my teeth, they're clean, why should I floss? So I should floss because whenever we brush our teeth, there may be food or bacteria that is still stuck in between those tight spaces of our teeth. So whenever we do floss them, the floss gets deep into those tight spaces and they're able to remove that. So that is why we should floss. Some modifications to flossing, it may be a little bit hard to hold those tiny pieces of floss, so some modifications while doing that can be to use interdental aids that we will talk about. We also have floss holders that may make it easier as well. And we are going to show you a flossing demonstration video, so if you guys just want to go ahead and watch this next.
In today's video demonstration, we will be showing you how to properly floss. First, you will break off about 18 to 24 inches of dental floss. In order to hold the floss correctly, wind most of the floss around both of your middle fingers, leaving only about 1 to 2 inches of floss for your teeth. You will hold the floss tight between your thumb and index fingers. Place the dental floss in between 2 teeth using a seesaw motion to gently glide the floss in between the spaces. You will glide the floss up and down, rubbing it against both sides of each tooth. As the floss reaches your gums, curve the floss at the base of the tooth to form a C shape. This allows the floss to enter the space between your gums and your tooth. As you repeat these steps and move from tooth to tooth, use a new, clean section of floss as to not spread bacteria between your teeth. Thank you, and happy flossing.
So next we're going to be talking about interdental aids. These are used for open embrasures, implants, orthodontics, and hard-to-reach areas. Sometimes floss alone will not be able to enter those concave areas, so that's where interdental aids come into play. Some interdental aids include water picks, water flossers, soft picks, single, tough brushes, and interdental brushes.
So we're going to talk about interdental brushes and soft picks. An interdental brush is going to have a stem like a skinny toothbrush, and then it's going to have a wire piece with some filaments attached to it. Sometimes they're shaped like little Christmas trees, and they get in the larger spaces in between your teeth. Then we're going to talk about some soft picks. So soft picks are, they're nylon, right? They're not metal. They have more of a plastic feeling. And then those are also going to be able to get in between each of those embrasures. If you're using an interdental brush, it is good to moisten it before you put it in those spaces. And then when you're finished with them, make sure that you are rinsing those very thoroughly because you do not want to reinsert again that bacteria into other sections of your mouth. Of what it looks like right here. So we have the little wire piece and it's got the filaments on it, so it's going to fit in between your teeth. So maybe floss isn't quite doing it, you have a larger space. This is what you're going to want to use. And then right here, this is our soft pick. So some of you may already use these. Again, it's more plasticky, not quite a toothpick, but again, it's soft and won't damage your gums.
Okay, next we have our single tufted or end tufted brushes. These are used for the interproximal areas or hard to access areas. When applying this to your gum line, you also want to point it a little bit towards your teeth and use a rotating motion and apply intermediate pressure. We also have our water pick water flosser. This is a pulsating, steady stream of water, and it's used for preventative and therapeutic measures. It helps remove bacteria, biofilm, and it'll help prevent gingivitis from occurring. Toothbrushes alone can only reach a little bit less than 1 millimeter into the gingival sulcus, which is your gums, whereas water flossers can penetrate 44 to 71% of your gum pockets. And also, I have a travel size right here. And you always want to start it off at the lowest setting. So move this. So right here, you always want to start off at 1. Don't start it automatically at 3. If you do, you can cause damage to your gums. And also, can come with different types of brushes or different types of points. So you want to make sure that you use the correct one, that way you don't damage your gums. And here are some examples again.
Into fluoride. Fluoride is a natural mineral that can be found in soil, water, and in the air. Fluoride helps strengthen your tooth enamel. So, for instance, if you do experience dry mouth, since you are at high risk for cavities, I would recommend using a fluoride. Fluoride can be found in your community water, our foods, toothpaste, and mouth rinses. Talk about toothpaste. Toothpaste is a substance that you add to your toothbrush to remove plaque from your gums and your tooth surfaces. So toothpaste isn't just one type of show. There's actually several different types of toothpastes that you can buy if you're experiencing any kind of oral problems. If you're having tooth sensitivity, whenever you're eating cold or hot foods, it's really painful, then we suggest getting an enamel sensitivity toothpaste. For those of you that are taking those medications and you're having issues with your dry mouth, there is something called Biotene. There is other brands that can also help with dry mouth. This certain toothpaste will help with dry mouth and also cavity protection. And then if you're having a hard time controlling that tartar or plaque, if you're still brushing, flossing your teeth, but you're still getting a high buildup, we would recommend you getting a tartar control toothpaste. And for those of you that really want to try your best to fight off that gingivitis, there is a gum protection toothpaste. Talk about mouth rinses. So mouth rinses, the main purpose is to destroy all that bacteria. So once we have flossed and brushed our teeth, the mouth rinse is really going to get in there and kill off all the extra bacteria that you might have missed. So there is 3 types of mouth rinses. We have our fluoride. Now we know that fluoride is super great for rebuilding that enamel to prevent cavities. And also this fluoride rinse will also help reduce gingivitis. Then we also have chlorhexidine. Chlorhexidine is the #1 used mouth rinse for clinical use. So it's going to be more seen in your dental office. So your dental hygienist will more than likely be using a chlorhexidine pre-treatment. They're going to have you rinse with it to kill any bacteria to prevent infection. And then lastly, we have our quaternary ammonium compound, really fancy word, but it's actually seen more often than the rest. It's actually of your Listerines, and it actually helps with biofilm accumulation.
Some more products that we can use. We have our gum detoxifier right here. Again, so if you've got some gingivitis, this is going to help you out. Those of you who have dry mouth or are taking those medications and are experiencing dry mouth, we have Oral Moist. They're dry mouth patches, so they actually help produce saliva. We've got our Biotene products, and we have them here on the table as well, but we've got a mouth rinse, we've got some lip care, so again, if you've got dry or cracked lips, they make that as well, toothpaste. And then our last one here is a picture of a dexterity tool. So for those of you who maybe an electric toothbrush tickles your nose, but you need that handle, your toothbrush just slips in. So anytime you need to change out your toothbrush, you can just, or maybe you want to use your interdental floss brush, you can use that. You can stick that also inside the dexterity tool and kind of help you hold on to it. Oh, sorry, I forgot you up there. And so our post-test. So today, medications don't affect the health of my teeth. Is that true or false? That is false. They do affect the health of your teeth. What mineral helps strengthen your enamel, prevent cavities, like Miss Kennedy was talking about? That's going to be our fluoride. And then number 3, how many times a day should you brush your teeth and for how long? That's going to be C, 2 times a day for 2 minutes each time.
Our takeaway for the day. So we did talk about a lot of things, but our main takeaways are going to be to be aware of aging and its effects on the oral cavity. We want to make sure that we're doing everything we can, that as we grow older, we are still taking just as much or even more care of our oral cavity so that we are able to hold on to our teeth as long as possible. We also want to take away and utilize modifications for brushing and flossing. So even though it might be a little bit harder to brush and floss, we did give you guys some handy tools and some handy recommendations in order to make brushing and flossing just a little bit easier. And lastly, to be aware of the products such as our toothpaste, our mouth rinses, and our chewing gums for dry mouth, as that is a common factor as to why we're having a little bit more oral health problems as we age. But other than that, that is the end of our presentation. Thank you guys.
Thank you.
And here are our